It's American Heart Month, and we want you to continue to have a healthy heart through this pandemic. Dr. Teresa Daniele is the Chief of Cardiology at UCSF Fresno, and she shares with us how COVID-19 can affect people's cardiac systems.
There are lots of effects to the heart, and I like to see them as direct effects and indirect effects. Direct effects, what we're seeing is there's actually damage or inflammation to the lining of the blood vessels themselves, putting us at risk of blood clots. So we're seeing a lot of blood clots in the legs, blood clots in the lungs, heart attacks, blood clots in the arteries of the heart, and to an extreme degree. And so we know that there's a direct relation to the virus and these events. Number two, it is affecting the sac. So we have a lining around our heart, and the sac, the lining, the pericardium is also getting inflamed. So we see chest pain scenarios that are due to direct inflammation of the lining of the heart. Number three, we're actually seeing inflammation on the muscle itself, so something called myocarditis. And there's a lot of studies that have shown, including MRI studies of the heart, that are showing direct inflammation to the heart muscle. This actually can cause ultimately weakness to the heart muscle, scar tissue formation, life-threatening arrhythmias, and so forth. And we're just discovering it's the tip of the iceberg. There's a lot of other studies that need to be had and a lot more understanding of the long-term effects that this would have. Patients are afraid. They're afraid to come get help. They're afraid to come to the emergency department. They're staying at home, infarcting, meaning having heart attacks at home, and blood clots in the lungs. They're having usual symptoms like appendicitis still happens. Regular pneumonias are still happening. And patients are afraid. They don't want to come to the emergency department. They don't want to seek medical attention because they're afraid of actually getting exposed to the virus in the emergency room or in the hospital. And as a consequence, we're having patients coming in, weeks later and so forth with severe, irreversible damage to their heart muscle and so forth. So yes, it's absolutely affecting our community, our nation, our world. The people who are worried because they have problems and about the vaccine are really the people who would benefit the most from the vaccine. So absolutely, anyone who has cardiovascular disease, heart attacks, strokes, especially overweight, diabetes, hypertension, and so forth, immunocompromised, those are all of the patients that are very high risk and would absolutely benefit from the vaccine. Remember to wear your mask, wash your hands, take a few steps back, right? You can still socialize with people, be smart about it. Be smart about it. This is not, we're going on to a year now, and it's taken a mental toll on a lot of people. And so it's a very complicated scenario, and there's no perfect solution, but we have to keep the course. We will get through this.